Hi, I'm Erika. I'm 34 and I live in New York City. I work as an attorney in the music industry with a focus on contracts. My mom is a two-time breast cancer survivor. She had breast cancer for the first time in 1993 when she was 28 years old. So I was about 7 or 8 at the time. So my memories of it, my first memory, I think, of my mom, knowing that my mom had breast cancer, is just remembering that she just didn't have a lot of energy. But she was very fortunate. She had stage 1 breast cancer the first time. She underwent a lumpectomy and then chemo and radiation. And then she was in remission for about 14 years. And then in 2007, when I was a senior at the University of North Carolina, she got a second diagnosis of breast cancer in a different breast. She also had triple negative breast cancer, which is a more aggressive form of breast cancer. And that's when her oncologist was looking at her medical file and was like, wait a minute, you've had breast cancer twice before the age of 50. You had breast cancer when you were 28 years old. And you also have triple negative breast cancer. I think you should undergo genetic counseling and testing to see if you might have hereditary predisposition to breast cancer. So that's when we learned that my mom has a BRCA2 mutation. If an individual has a BRCA2 mutation, they have a 50-50 odds of passing it on to their children. So when I found out that my mom had a BRCA2 mutation, I knew that I had a 50% chance of having it as well. I had my genetic testing done in June 2014. I got the results about 3 weeks later, and the results were positive that I had inherited my mom's BRCA2 mutation. So I was very fortunate. I had my genetic counseling done by an oncologist who was also certified to do genetic counseling and testing, which was really great because she was really sort of a guide through the whole process. And so she was like, I'm looking at your family history. I'm seeing how young your mom was when she had breast cancer for the first time. You're 29. My recommendation to you is to have a preventive mastectomy as soon as you can have it. And you are more than free to, get other doctors' opinions, but that is my medical recommendation today, which is a lot to hear when you're 29. I mean, I think it was a lot to hear when you're any age, but certainly when I was 29, I was like, okay, I was not expecting to have that conversation with you today. So one thing I always tell people, because when you hear BRCA, you just think about the breast cancer part. It also puts you at risk for a lot of other cancers. And so the really great thing about seeing someone like Dr. Smith, who is an oncologist who also does genetic counseling, is that she sort of sprang into action. So she's like, okay, I think you should have a preventative mastectomy very soon. I'm going to connect you with a breast surgeon and a plastic surgeon that I recommend to a lot of my patients. She also connected me to an OBGYN who specializes in gynecological cancers, connected me to a dermatologist, an ophthalmologist. She just had a whole checklist of people. But for me, the next step was meeting with a breast surgeon and a plastic surgeon. When I found out I was maybe going to have surgery, I started doing some research, and I really wanted to have a nipple-sparing mastectomy. And so when I met with Dr. Choi, she did an exam, and she's like, yes, you're like a 32C, you have really good skin, you're just the right size, I think I can do a nipple sparing. And she was also like, I can do a direct-to-implant surgery. She's like, I can do nipple sparing and I can do direct-to-implant. I was like, great. So Dr. Choi gave me a few different options. One was saline implants. The other recommendation was a silicone implant. Specifically, she had recommended Natrelle implants. There's also a lot of really great websites online. So there's Facing Our Risk of Cancer Empowered, Force, that has a lot of really good information. So I had a really good combination of, really knowledgeable friends. And there's also some, and those really great resources that are out there on the internet. And so there's a couple of pieces of advice I always give people. The first is that you don't have to have surgery. I always tell people my decision to have surgery was, very specific to my family history. There are other options. You can undergo enhanced surveillance. You can take chemopreventative drugs. You can maybe undergo surveillance for a while and then choose to have surgery later. So the first thing I tell people is don't put this off because you automatically think you're going to go and have a mastectomy 2 weeks later. I think the other thing that I often tell people, and it sounds really cliche, but I think it's really true, is that knowledge is power. I think about all the time if someone had told my mom, between 1993 and 2007 that she had a BRCA2 mutation. Maybe she could have taken steps to avoid her second breast cancer diagnosis. Maybe it wouldn't have come as such a shock. And so that period of time between when I got the genetic testing results and made the decision to have surgery was really tough. But it feels so good to not have the weight of thinking about, oh my God, is this going to be the day that I get breast cancer, sitting over my head. So I always just tell people it's better to know and be able to do something about it versus sort of burying your head in the sand. And the other thing I often tell people who are thinking about genetic counseling and testing is that I had my reconstruction in December 2014. I think my plastic surgeon did an amazing job. But even in the past 5 years, there's just been so many additional advances in the reconstruction process, and just helping people understand, their rights under their insurance plans, just the different options that are out there. I always just try to, when people ask me about it, I want them to walk away feeling empowered, because I do think ultimately what I did was a very empowering decision, although obviously when you're in it, it can be very scary at the time. So when I found out that I had the BRCA mutation and I made the decision to have surgery, for people I was very close to, I took them out to dinner or drinks and we sat down and talked about it. I would say everyone was overwhelmingly very supportive. And a lot of my friends were like, what can I do? What can I do to be helpful? Are you going to need people to be at your apartment when you're recovering from your surgery? My bosses at work were extremely supportive. They were like, take as much time as you need. So I even now when I look back on it, I just feel so, I can't really think of the word, just overwhelmed by how much love and support that I got. And so after my own experience, I started doing a lot of research and sort of learned that women of color are often don't have access to genetic counseling and testing. They're not referred at the same rates, even when they meet the medical criteria to be referred for genetic counseling and testing. So in the past 5 years since I had my surgery, I really have sort of developed this voice as an advocate, because my hope is if someone sees this and they realize, oh, wait a minute, my mom's had breast cancer, my grandmother's had breast cancer, maybe I have an aunt, it sort of spurs them to start thinking about seeking out or getting information about genetic counseling. And I also hope by sharing my story, it just dispels some of the myths around this and maybe takes away some of the fear from people. Maybe someone watches this and they're on the fence, and now this spurs them to make that appointment. So that's my hope. So in my role as a Natrelle brand ambassador, one, I really hope to educate people about what their options are, and to also know, I think sometimes women are, obviously your breasts are so much associated with your femininity and your sexuality. And I want people to know that there are these really great options out there like Natrelle implants. You can have a really positive reconstruction process, even if you're going through a very scary thing like being a previvor or dealing with a breast cancer diagnosis. My mom has been in remission since the end of 2007, so she's approaching 13 years of being in remission, which is great. And, when I found out that I had inherited her BRCA2 mutation, she was very upset in the beginning. She felt like it was something that she had done to me, but she was ultimately very supportive and very happy that I made the decision to have a preventative mastectomy. She came to New York City to be with me for the surgery and stayed with me as a caregiver for a couple weeks. And she is always so impressed. She's like, I don't know if I would have the courage to talk about this the way that you do, but she's very supportive of all the things that I do.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.